So to summarize, a natural pregnancy requires 5 or 6 things to fall into place. These are: the egg that should grow should be of good quality, the tube should be functioning, the sexual contact has to take place successfully at the right time, and enough sperm should be able to travel from this point till this point, and the womb has to be receptive. Also to remember that even if everything was working fine, no woman would be able to pick up the egg through her tubes every month, nor would her eggs all be very good. So in natural pregnancy cycles, the chances of pregnancy are only around 20 to 25% per month. That's because the egg is not of good quality, the tube doesn't pick it up every month, and every month the sperms cannot travel all the way to the tube, and the womb is not receptive every month. So in other words, we have to understand that human beings are some of the worst reproducers in animal kingdom. The chances of pregnancy are as low as 20-25%. On the other side, we also need to understand that if there is a natural embryo that has formed, it is usually formed from the best egg that was available and some of the best sperms that were deposited in the vagina. So the chances of the embryo, if it is actually formed, to implant is close to 100%. So whereas the embryo doesn't form every cycle, but if it does form, the chances of implantation are very high. This is what stands out in a natural cycle. So in this section, we've realized that humans are, after all, very poor breeders. There's hardly a 20-25% chance per month of getting a pregnancy. And that also, remember, for young healthy couples. If you do not have the best of health, if your age is more than what it should be, and then there are complications like diseases, then the chances can only come down. Which is why, believe me, almost 15% couples who are trying out there to get a child are not being able to conceive. For most of these couples, eventually an IVF may be necessary.